So good afternoon. Thank you for joining us. I'm Tamara Montague-Smith. I'm an assistant professor of management at UMass Lowell and an affiliate with the Center for Promotion of Health in the New England Workplace, or CPH-NEW. I'm pleased to have been invited to host this presentation and introduce our speaker for CPH-NEW's quarterly webinar series on trends in total worker health. If you're interested in learning more about CPH-NEW or total worker health, please be sure to visit our website. And CPH-NEW is one of 10 centers of excellence for total worker health, funded by the National Institute of Occupational Safety and Health, or NIOSH. Our center is jointly located at the University of Connecticut and University of Massachusetts Lowell, and we host a range of education and networking opportunities. So be sure to follow CPH-NEW social media and be notified first. All right, so at this point, I would like to introduce our guest for today, Peter Hasle. So Peter Hasle is a professor of global sustainable production in the Department of Technology and Innovation at University of Southern Denmark. His research focuses on integration of economic sustainability with a particular focus in occupational health and safety, productivity, and quality. He has covered a wide scope of topics, among others, organizational capital, social capital, OHS management, and lean-in sectors such as hospitals, garment, construction, and agri-food. His research has a wide geographical coverage from Denmark over Europe to emerging economies in Bangladesh and others. So without further ado, I turn it to Peter.
Thank you very much for the invitation and the presentation. I've really been looking forward to share my ideas with you. So I prepared the presentation for this webinar, trying to summarize my research for the last 15 years, where I've been occupied with this, trying to understand how can we integrate occupational health and safety with operations management. How can making workplaces safe and healthy be part of the way we are running the businesses, rather than it's something standing on the sideline. And I will try, I will warn you to be a little provocative today. And maybe some of you will find it provocative. Some of you may also find it, this is just evident what I'm saying. We will see how it goes. I also have many things to share, so I hope I can follow the time limit we have, and we get the chance for some discussion afterwards. I would be happy for critical remarks as well. And as you can see, I will try to share experience from both emerging economies, garment industry in Bangladesh, hospital sector in Denmark, to tell that even though there are very, very large differences, there are also similarities, and there's a basic understanding about what is an organization, what's the purpose of an organization, which we need to understand in order to start working with integration. Just then jumping into it, we can start saying operations and us, are they complementary or contradictory? It has been a long-standing discussion in the literature. Already back nearly 100 years ago, Heinrich argued that safety pays. We have a number of studies saying that safety pays, or safety and health pays. But we also know that there are so many problems out there. So if they pays, why don't employers invest in it? Was one researcher, Dorman, saying 23 years ago. And that's the first part of this discussion, is then to say that even though it can pay off, it's not so simple that companies that just invest in it. If we think of investments, they will always have multiple investment options which will pay off, but they don't have capacity to invest in all. And in most cases, us investments are considered as a sidecar. They don't contribute to core business goals. It's even difficult to measure if we get any economic benefits, and even be certain that do we get more safety, health, and well-being among workers. So this just saying that we make a study and then we measure that there will be some kind of payoff from a specific investment doesn't mean that companies will take that investment up, because they have other more important investments inside their limited capacity. So to take that further on, contribution to business goals, we look a little bit into some basic organizational theory. All organizations, they are created to achieve a certain purpose. That counts for both private and public organizations. They exist to provide a product or service needed by someone, being that customers, being that citizens. They need to secure resources and be legitimate so that they have some input to transform something into a product or service. They get some output which someone can use for something. That's the reason why taxpayers will accept the public service and customers will pay it. And you can say, to be frank, that neither private nor public organizations are born to make health, safety, and well-being at work. They're born for something else. And as we are safety and health researchers and safety and health practitioners, we tend to believe that maybe they are, because that's what we are occupied with. So achieving the purpose is always the first priority. If they don't achieve the purpose, there are no organization, and thereby no workplace and no health and safety. And it's also priority for workers. And this priority for workers, I'll get back to that, because that's actually a key and, in my understanding, partly neglected research item. And that comes with that doing a good job is actually a key element in worker well-being. So to follow that thread a bit, we can say that looking at work is fulfilling the need for being a human. Not only the physical needs, we need a salary to provide for food and other things, but it's also shaping who we are, shaping some of the basic needs we have for autonomy, that we can organize things we want ourselves, we can do it ourselves, that we have competence mastering tasks and achieve goals, that we are connected to other humans, give and receive care and recognition, that we experience contributing to something outside ourselves by providing a product or service or part of it in our workplace. So we can say that collaboration with others to fulfill task goals and organizational purpose is a key factor for worker well-being. And thereby, the core idea of operations management is important for the workers' well-being. And that leads to the next slide with the question, is safety first? We all know this sign, mainly on construction sites, but also on other workplaces. Safety first before you do something. And as I just mentioned, any workplace is there to fulfill a purpose. And the focus in the workplace is on planning and execution of the work in a high quality and efficient manner. And our profession, we focus on being safe and healthy. And most often we think that it's so important to promote safety and health that we don't pay attention to the basic quality and efficiency of production, and believe that the whole organization is for that. So how is it our business? And if we do that, we help to push health and safety into the sidecar. Or we can say, with a soccer analogy, what we in Europe call football, we are standing shouting on the sideline, take care, avoid tacklings, avoid hitting the ball. We know that's unhealthy. Many studies showing that, but players don't care. They want to win the game. And the question is then for us, can we help players win the game in a more safe and healthy manner? And the initial question on this slide then is, no, safety is never first. It's always the purpose, the task is first, and then we can start safety. And when we promote safety first too strongly, I agree, it can be good to have on a construction site, but if we promote that too strongly, we are actually pushing ourselves more and more on the sideline of the soccer field, and then they are playing their own game and don't take care of what we think. So what's the leverage when safety is not first? So there are three legs of that. There's regulation. Basically, the market cannot secure healthy and safe workplaces. And even for the integration I am promoting, the platform of regulation is necessary for priorities. And therefore, integration of operations management and us is not an argument for deregulation. Then there's another part, another leg saying that we know that companies with integrated strategies and practices, they're actually doing good. They have a workforce with high motivation and engagement. They have low absenteeism and turnover. They have high innovation, high flexibility, and others. And the third leg is increasingly market requirement for social sustainability with UN Sustainability Development Goals, corporate social responsibility, environment, social and governance, reporting, due diligence. I will say a little bit more about that later. And I will start telling a bit about each of these three legs, and then some of the examples from my earlier research. So first, integration through supply chains. So that's what was partly the final leg, that we have supply chains. They are increasingly subject to public scrutiny and international regulations. Buyers, they issue codes of conduct for suppliers. They request certificates and audits to prove compliance because they have a reputation risk if they don't do it. They want to have more efficient supply chains. And UN have issued this guiding principle for business and human rights, SDGs. And then there are, I'm not aware of US, but at least in Europe and several countries, and also European Union regulation are coming up in these years for ESG reporting, social, environmental, and governance reporting for due diligence, which is a full risk assessment and action planning exercise. And that's a whole story by itself. But this is to tell that there's also something coming from outside, which is not the traditional OSH regulation like you have with OSHA, but coming from international regulation and coming from international business demands. And it is backed up by the SDG 8, decent work and economic growth, which is actually supporting the integrative perspective. It's born with with having integration. We need economic growth to reduce poverty and secure jobs, and also to invest in climate and other things, not least. But we also need decent jobs. And we can say that is easy and logical to suggest at the macro level. Everybody can agree on that. Although we have structural developments related to globalization and neoliberal economic policy, creating labor market inequality with no jobs or jobs with very poor working conditions. But still everybody agrees to decent work and economic growth. But it's very difficult to realize in practice at the micro level, the shop floor, where we have basic decoupling of operations management and OS management. And that's then the next step in my story, is to say, why is it so difficult to do that at the shop floor? And we can say that even when it's beneficial for performance, it's not working. One reason for that is that the economic man, the basis for most of the economic science we are bothered with from economists, is that the economic man is not is a myth, and neither individual nor companies are fully economic rational. So that even though we know that it can be beneficial for performance, decoupling will be strong. And a key explanation for that, I will fold out a bit more, is what I call institutional logics, creating a barrier for integration, where us managers and operations managers, they have crucial differences in understanding what are we doing here. And a little theory about institutional logics, building on basic institutional theory. And logics, they emphasize how values, beliefs, practices get institutionalized in organization. They provide actors meaning to otherwise banal activities, and they give direction how to understand and how to act on various issues. And the professional field has basically one dominating logic, and when you're inside that, it limits the possibility to accept and understand other logics. But of course, there are several professions in a company, so there are various kinds of constellations of logics. If we then look into production, we have the dominant logic, operations, and key goal is optimization. So what operations, whatever it's physical production, service, or providing a public service, it is optimizing what we are doing to achieve our key goal. We work with improving economic performance. We use various kinds of scientific management methods. We make rationalization. We try to make continuous improvement programs and practices. And then we have our health and safety sideline logic, where we work with risk control, avoid damage to health. It's some parallels to medicine. We use risk assessment as a key tool. And you can see that when we try to look into risk, we are trying to tell operations that something may happen, it may not happen, that there's a certain risk, and they have to take care of that when they occupy with optimization, when they are occupied of reaching key goals. And therefore there are weak links between these two. So logics can be competing. What's mainly happening is that they are simply decoupled. Operations, they do production planning, they are applying lean tools, they are measuring KPIs and others, and they are doing that by themselves. And then we have some OS managers, they are doing accident reporting and analysis, they are doing risk assessment, They are providing PPE, they are issuing safety rules, and they are doing that by themselves, and operations are not really caring. It can also be more open conflicts that they make safety and health shortcuts. A lot of that we see in practice. They are not doing risk assessment when they are optimizing or buying new technology. And in ops management, they are making safety rules, delaying production. They are requiring a lot of time-consuming paperwork to try to secure operations are doing what they're supposed to do. So this is the basic conflict we have, which is difficult to actually integrate, because people, they are thinking in different ways, and we are thinking in different way, which is not easy for operations to grasp. And we see the same thing in supply chains, that we have a buyer with a procurement unit taking care of ordering, price, quality, and delivery, production, keeping costs down. And then we have now CSR departments, ethical departments, sustainability departments. They issue code of conducts, and they are communicating with compliance at the supplier. And internally, there are weak links. So they are just doing both things. They are not really disturbing each other, and they can write sustainability reports and CSR policies, the buyers on their homepages, not having any real influence. There is now a trend towards convergence. If we think of operations, there's an increasing focus on risk management to try to avoid any kind of production disruptions, including then also worker health and safety, and on creating attractive jobs with committed employees, because in most cases, companies, they need workers, employees who are actually committed to take a responsibility to make the right decisions, to try to find solutions, to collaborate with others. And that is then helping, because in health and safety, we are also now trying to move into not only avoiding negative health effects, but also creating meaningful jobs and well-being. A little bit like I started to say, with work being important for well-being, that you're doing a good job and not just a safe job. So if we look what's the rationale behind either decoupling or integration, we can say that most companies, they follow what we could call a decoupled minimal cost strategy, which require less management strategy and operational efforts. Even though it weakens human and social capital, low motivation, absenteeism, conflicts, hamper innovation, they have cost of repairing damage. We have an integrated strategy where we can see that practices to improve operational effectiveness, they're similar to many improved OS outcome, empowerment, continuous improvement, prevention of defects, and prevention of accidents. Management systems can actually serve both. We can increase motivation and engagement, reduce absenteeism. And we have studies showing benefits of the integrated strategy. We have also some who couldn't find any benefits. And in practice, most companies survive on the decoupled minimal cost strategy. So what I've drawn, that I've tried to draw a picture saying that we have this decoupling in practice. We have some forces pushing for better integrations, but it's difficult to reach down at the shop floor. And the question is then what to do about it. And that's where I'll try to show some examples from my research about how we have been doing. We have worked a lot using Lean. Lean has been quite controversial, mainly older studies from 90s and zeros, they showed negative effects for workers. Reviews of newer studies point towards more positive effect for workers, and the main conclusion is it depends on how lean is applied. And why I'm promoting lean is that it has a strong potential for integration. It can supplement socio-technical system design, which is the basic system of designing how workers can collaborate in order to get healthy and well-being at work. And the idea with lean that it is that it can give a deep insight in organization of work, using some of the basic lean tools, value stream mapping, Kaizen, visual management, 5S, when it's controlled and applied by workers with a focus on both productivity, quality, and health and safety. So you can say that what we want to achieve is continuous improvements of productivity, quality, and us. So we work with all. And when we involve workers, the tendency and my experience is then for natural reasons, workers, they also take up health and safety issues when that's part of the problem in the workplace. We have used that in quite a number of different workplaces, and I've shown some examples from hospitals and from garment industry. Starting with garments, we had a project, we call it P-Lean, so how to improve psychosocial work environment using lean. And the point of departure is a regulation requiring regular risk assessment in workplaces, both Danish and EU regulation. The most used method is employee surveys, and the experience is quite poor. Workplaces cannot really find out how to translate general service data to actually workplace improvements. We then suggested to use value stream mapping because it gives an opportunity to focus on the microprocesses in the work, which can create stress and inefficiency. And we developed and tested methods in a large university hospital in Copenhagen, 5 wards: clinical physiology, nephrology, general medicine, gynecology, and pediatrics, and got some quite promising results. I've taken one example from urology examinations. Sorry, I've just drank a bit. Where the workers pointed to a basic conflict about patient access and waiting time when they were planning and carrying out examinations. And they put the problem into personality problems, that the nurses and assistants and the planners, they were fighting about having their patients getting a time of unclear messages, and they tried to kind of avoid each other. They showed lack of respect. They had some production problems, that they have patients coming in and they couldn't get their scheduled examination. They could carry out 26 examinations every day. They had, when they did the value stream mapping, they mapped a process of 11 steps involving 4 employees. They had diuretics to use, inconvenient for the patients because they were not prepared for the examinations. They have disturbing phone calls from reception during morning scheduling tasks. So it was a problem which was actually reporting from the staff that this is very stressing and our main problem in the workplace. And when we then try to look into using lean and say, where's the problem in the process, and therefore removing problem causes from personality to disturbance in a workplace, work process that needed focus. So disturbance in the planning, which is then disturbing the whole day operations. So we moved from avoidance and lack of respect to helping each other. We had this denial, which was actually removed. We increased the number of examinations each day. We reduced the process to 4 steps, making it much simpler. We avoided the use of diuretics. We avoided disturbing phone calls from reception. And what we found out in this process was simply that the staff planning the day, they had to combine some acute patients coming from emergency and then the planned examinations. And at the same time, nurses and assistants, they were meeting in and they were requesting planners to take care of their problems, then ending up with having no real plan for the whole day. And they have been discussing that for years, and they are focused on reducing stress, and it didn't help. But a lean intervention doing value stream mapping, focusing on the microprocesses and the disturbances in the microprocesses could actually solve the problem. Then looking into garment industry, we worked for several years in Bangladesh, starting with making an assessment study of 50 garment factories, measuring maturity level of operational practices and maturity level of OSH practices. What we found was that even before any intervention, we could see that these 2 factors, they were quite linked, not completely, but with quite a large correlation. There were a few factors also in Bangladesh doing quite good, and then most factories being medium or poor. And on that basis, we decided to use lean to integrate OSH and productivity. We used some of the basic tools, value stream mapping, to identify and remove waste. We used 5S, which is a method to create efficient and safe layout and workstation design, visual management to show how we're doing in terms of performance and OSH, Kaizen to make continuous improvements efforts involving workers, and then there are many other different tools. What we came up with was, after intervention in 12 garment factories, with something which looked like this, a strategy. We needed to have a top management commitment, and that's the basic for selecting the intervention factories. We worked with integrated lean intervention, so when they did value stream mapping, they mapped both what they in traditional lean languages waste, but also waste in the term of safety and health for workers. We tried to improve OSH practices and operational practices, and we worked on the understanding that both improvements in both these fields could improve health, well-being, and safety and productivity. And what we experienced was that we got a short-term reduction of fatigue and pain with approximately 20%. We had value-added time, a measure of how efficient the value stream is, with 100%, efficiency with 25%, better housekeeping, better quality. So we had strong results on both. Important to realize also is that among the factories, there was quite wide dispersion. So some of the factories, they actually got stuck and couldn't do anything, and some of them, they did even larger improvements. So it's also something which is not easy to do, and for many reasons. Part of it, of course, lack of sufficient management commitment, and also, and that's a long story I cannot tell today, but also some competing logics and understanding about how do we understand to be a competitive garment factory. So that's the lean approach. Then back to hospitals. We have worked with what we call collaborative and enabling bureaucracy to improve efficiency, quality, and well-being in hospitals. We are building on some little old research, but which has also been renewed in the terms of collaborative enterprise by Paul Adler and colleagues, where we are looking into what we call social structure, which can be enabling, helping workers, or coercive, trying to discipline people, can be simple or complicated. And coercive, that's autocratic, top-down, coercive bureaucracy, that you have tried to in details tell people what to do. And then we have also, in complicated technical structure, we can have enabling bureaucracy, and that's what we tried in the hospitals to develop it bottom up, controlled by involved stakeholders, and basically meaning something they're doing in the wards themselves. And then we try to look at, so what does enabling bureaucratic elements means? Something about proximity, that you're close to each other, you define roles, you have some artifacts, can be hardware, software, helping, you have rules, your plans and routines. And I have an example from one of our cases at trauma bed units, and they had problems with bed rounding, and many wards, at least from my experience, I guess it's also the case in your hospitals, they have difficulties in organizing roundings because doctors are not there when nurses are there, and nurses are not there when doctors are there. So it's creating stress and inefficiency. So they decided, trying to do something about it. And what we could see was that they designed locally at what we call an enabling bureaucracy, because they made rules and routines and roles and artifacts about how are we going to do this, and ending up solving the problem and reducing their stress. So they decided that we made an early pre-rounding morning meeting, a huddle, where we decide what are we doing today. And part of that was teaming up a nurse and a doctor, saying, you have these 5 patients to do rounding, and then you decide, the two of you, when are you doing that together, and how do you coordinate so you're there at the same time. They had a nurse to coordinate that activity. They have artifacts, electronic boards to manage. They made templates for another thing to help daily operations, which is prescription rights for nurses for specific medicine, helping the doctors for some of their tasks, that they could make resource allocation decisions by the coordinator, like nurse. They made phone calling practices so that the coordinating nurse took the phones and it was not going out to individual doctors and nurses, so disturbing all of them, and she was then the one to distribute if needed to other people. So this is an example that it's not necessarily that lean is the only way to this. The way is that at the local level, you collaborate about solving the problems and trying to find solution. So in this place, the trauma bed unit, they identify a major problem for efficiency and for stress, and then try to solve the problem at the local level. It was not decided from above. They had the local autonomy to do it. That's important. And then they, during a period of time, a couple of years, they took one decision after the other and implemented it, and ended up solving the problems and having a very efficient operations compared to other places. So that's another example of how to do it. And then I'm starting to to sum up with the last slides, then first to say how to think then for practitioners. And we can say that practitioners, they mainly build on knowledge about health and safety. They know about the risks, they know how to prevent the risks. They build on regulation, what's the requirements for in our company to follow. And what I then suggested to think of practitioners as both professional and political navigators, because they're going to navigate in the organization to achieve improvements. And when they do that, they need to think of two things. They need to think of how do we contribute to achieve company purpose? Going back to the soccer game, how do we find safe methods to achieve the goal of the team? They want to win the match, not just standing on the sideline shouting and then taking care of people when they are carried out on a stretcher. And then also something I haven't had the time to fold out is to say they need to participate in the internal political process. They need to influence what's going on in the teams, in management. They need to join management teams, operations meetings, and so forth. So this is, in a very few words, about expanding the traditional strategy for us practitioners. And if we then look into research, I will point a couple of perspectives we need to increase our research on. So first thing is that we need to look into meaning of work and task completion. In my understanding, this is something we have in safety and health studying all too little. We are studying into stress factors, and we're studying into accident risk and others. But actually, for workers doing a good job and providing something for others, whether it's colleagues or another unit in the company, or it's for customers or citizens, that is actually the basic element of well-being for the workers. And the study of that is fairly limited, I would say. And then, of course, link it to organizational performance. But the traditional safety pays, where we try to see, now we make a safety measure and then we measure whether it paid off. I think this is not really the way to go. But more to say, can we focus at how we do a good job, and how that's related to safety and health and performance. Then we need to study mechanisms for facilitating and hampering integration, so we understand that better. How do we merge some of the institutional logics, for instance? How can we work with that? And then also very important when we're doing intervention research, I think we need to think of, rather than focus on stress prevention in hospitals, we should focus on collaboration and obstacles for high quality and efficient patient care and treatment. When we do that, stress will be reduced. So my suggestion is, in fact, that we can reduce stress without ever mentioning the word stress. And if we focus too much on how can we reduce stress and how can we reduce demands and other things, then we end up on the sideline and we are not making any changes. And if we take the example from the garment industry, from focus on us, how do we make it more safe, to focus on how do we integrate productivity and us improvements, because we want to take the whole production process and improve that, including making it more safe and healthy. So I think that's my words, and hopefully, yeah, there's still a little time left for questions and discussions, and I would be happy for any critical remarks you may have. I think it's time for me to stop sharing.
Well, thank you, Peter. I think that's all the time that we have for today. But it's such a great conversation. Everybody's already ahead of me, but we'll give you a nice round of applause. So thank you again for um, being here today and sharing your insights with us. Enjoy the rest of your day, everyone.